Hi everyone, welcome to and thank you for viewing our debate on causes for autism. I'd like to start by introducing all members of the debate, myself, Courtney Niddle, Aaron Holsey, Allison Nowak, Rita Mason, and Aaron Mockamer. Through this debate, 3 different causes for autism will be discussed: MMR vaccination, the refrigerator mom theory, and environmental toxins such as lead and mercury. Within each cause, a stance for and against each theory will be debated. After each theory is discussed, a moderator will aid in summarization along with some of the ethics within the topic. There are some rules each speaker will follow. Pros and cons will alternate in a turn-taking fashion. Others part of this debate will remain quiet until their turn for speaking. Debate members should not speak over one another. Each speaker should not exceed 2 minutes in length for each stance presented, and each theory should not exceed 10 minutes in length. Each cause will be introduced, and pros and cons will take turns in explaining their arguments, which will be supported through research studies. Ethical considerations will be explained as abiding by the BCBA Code of Ethical Guidelines. Now we shall begin with first discussing the theory of MMR vaccinations. Aaron Halsey will be presenting the pro stance, and Allison will argue the cons.
Thank you, Courtney. I will be discussing the research conducted by Andrew Wakefield in 1998. His study was published in the British medical journal The Lancet. In this study, Wakefield et al., 1998, he suggested that regressive autism and severe bowel problems might be associated with the MMR vaccine. Wakefield's gut theory stated that the MMR vaccination could produce severe bowel problems and regression in development that manifest autism. Wakefield speculated that the measles virus in the MMR vaccine makes its way to the child's gut, leaked through the gut, and entered into the brain and then caused autism. After his study, Wakefield reported to the media that his work strongly suggested a causal link between the vaccine and autism. To this day, Wakefield continues to endorse these beliefs. It is Wakefield's researchers and all behavior analysts' obligation to follow the BACB Code of Ethics. Code 8.01, Public Statements, says that the analyst should accurately represent all the services they provide when giving public statements. This includes any published material. Code 9.0, Behavior Analysts and Researcher, states that behavior analysts design, conduct, and report research in accordance with recognized standards of scientific competence and ethical research.
Well, while Wakefield may have had some research that looked as though to be convincing when stating that the MMR vaccine is a cause of autism, there are also many ways in which things just do not add up. Within the study done by Madsen and his colleagues that was conducted in Denmark, it was found that, first of all, the risk of autism was similar in vaccinated and unvaccinated children in both age-adjusted and fully adjusted analysis. Second, there was no temporal clustering of cases of autism at any time after immunization. And finally, neither autistic disorder nor other autism spectrum disorders were associated with the MMR vaccination. With that, Madsen and his colleagues noted that all previous studies on the MMR vaccination looked at an association between autism and MMR vaccination that were case series, ecological studies, or cross-sectional studies, and the majority have not used optimal data for risk assessment. No studies have had sufficient statistical power to detect an association, and none had a population-based cohort design.
Parental attitudes, experiences, and social grade are influential in determining whether a child receives a vaccine. Between 1996 and 2006, parents' spontaneous awareness of the MMR vaccine was at an all-time high of 95%. The MMR vaccine is given after 12 months of age, and the features of autism often become apparent at around 18 months. Parents are likely to blame the vaccine when behavioral regression soon appears after the administration of the MMR vaccine. In the Smith et al. Study, 14% of parents felt that the MMR vaccine was a greater risk than the diseases it protected against. Some parents choose to delay the vaccination or ask for them to be administered separately because of the fear that the MMR vaccine could cause autism in their child. Studies show that MMR is the vaccine least likely to be considered safe. Parents find themselves trying to deal with internal conflicts over the perception of the safety of the vaccine and the danger posed by the diseases that it protects against. Vaccine-hesitant parents, also known as VHPs, choose to delay, omit, or pursue alternative vaccine schedules due to concerns about vaccine safety and misperceptions about the risks and benefits. Some believe that giving the combination of 3 vaccines can cause damage to the infant immune system. There have been an increased number of parents who refuse to vaccinate their children since the publication and reports to the media by Wakefield. The study Andrews et al. In 2002 found that parents of children with autism diagnosed after the MMR controversy were more likely to report the onset of autism after the MMR vaccination than were the parents of children with autism diagnosed before the controversy.
While Erin is right when she states that parental attitudes and experiences during the process of vaccinating a child can play a crucial role in a child's overall health and development, it is not going to be the determining factor on if their child miraculously is diagnosed with the autism spectrum disorder. One of the main reasons for parental concern of the MMR vaccine is because of the widespread use of this vaccination in some regions throughout the world, which appear to coincide with an increase in the incidence of autism. In the study I previously stated by Madsen and his colleagues, the prevalence of autism from the MMR vaccine was not a universal finding because in Denmark the prevalence of autism was less than 2 cases per 10,000 children between the ages of 5 and 9 years in the 1980s and the beginning of the 1990s. Since then, rates have increased in all age groups and was higher than 10 cases per 10,000 in the age range from 5 to 9 years of age. This shows that the increase in autism had occurred in multiple regions well after the introduction of the MMR vaccine, which should show parents that the cause of autism truly is not because of the vaccination.
The media and internet have played a critical role with influencing parental confidence in the MMR vaccine. MMR has been one of the most researched vaccines in the last 30 years. This fear fuels an anti-vaccination movement with the help of media, especially the internet, celebrities, and politicians. Anti-vaccination movements can be found all over the internet. The fear over vaccines fueled by anti-vaccination movements using internet or other media causes more and more parents to refuse immunization for their children. Because of that, between 30 and 40% of pediatricians are now having to discharge patients whose parents don't want to vaccinate their children. Here is a visual supporting the internet's role and its involvement with the MMR vaccination controversy. The media plays a vital role in how the public interprets scientific findings. Not everyone knows how to access scientific papers, let alone how to decipher its scientific jargon. Most people come in contact with information through secondary sources like the media. It is simply more comprehensible and more available to the general public. However, the media, including the internet, isn't necessarily the best source since it can be biased and is not subject to peer review. This visual shows the support of the internet's role and then decline of the MMR vaccination in the aftermath of the MMR autism correlation. Figure 1 compares the number of scientific papers published per year about the MMR vaccine and the number of news story results on Google for MMR plus autism searches. As the years went by, news stories continued to emerge in the media while there were less reportable scientific publications. In Figure 2, the gray line is taken from Figure 1 and represents the Google News report about MMR plus autism. This graph demonstrates that an increase in the number of news story results on Google for MMR and autism directly correlates to the drop in the MMR immunization rates. The media's role and its relation to autism and the MMR vaccine ties into the Ethical Code 8.05d, Media Presentations and Media-Based Services. When a behavior analyst provides advice or comments by means of electronic media, they take reasonable precautions to ensure that 1. The statements are based on appropriate behavior analytic literature and practice, and 2. Statements are otherwise consistent with the code.
It is understandable that parents may take to the media as it plays an influencing role in their beliefs towards the MMR vaccine, though the media is not always right. Offit and Coffin stated that there had been media coverage of a small case series published by Wakefield linking the MMR vaccine to autism, which resulted in a loss of confidence and decreased immunization rates in England, though With the many rigorously controlled studies performed in the United Kingdom, Finland, Denmark, and the United States, there was no found evidence that MMR vaccine causes autism. This then makes it hard for parents as they hear different information that the internet provides on the topic of autism and the MMR vaccine, which ultimately results in parents continuing to stay concerned with the possibility that the MMR vaccine is not safe. In just one study I recognize that was done by Miller and his colleagues, they conducted a study that took a look at clinical records at special schools in the North Thames Health District within the UK during the year of 1979. They looked for evidence of a change in trend in incidence or age at diagnosis associated with the introduction of the MMR vaccination to the UK in 1988. Clustering of onsets within defined post-vaccination periods was investigated by the case series method. The study found that there was a steady increase in cases by year of birth with no sudden step up or change in the trend line after the introduction of the MMR vaccination. There was no difference in age at diagnosis between the cases. This increase may be real, but may also be a reflection of other factors such as better recording arrangements in recent years, the increasing recognition of higher functioning children with autism and Asperger's syndrome, and an increasing number of professionals trained to recognize the disorders. This is then where the media and internet have taken the role of providing these ideas, giving parents a false information that autism is in fact caused by the MMR vaccination.
The majority of the research presented supports that vaccines do not cause autism. However, there have been some arguments that indicate otherwise. In 1998, Andrew Wakefield suggested that the MMR vaccine could produce severe bowel problems and regression in development that manifests as autism. Wakefield reported to the media that his work strongly suggested a causal link between the vaccine and autism. Additionally, parental attitudes have played a role in determining whether a child receives a vaccine. Parents may find themselves with internal conflicts over their discernment of the safety of the vaccine and the danger posed by the diseases that it protects against. Some believe that giving the combination of 3 vaccines can cause damage to the infant immune system. This has resulted in an increasing number of parents who refuse to vaccinate their children. Lastly, the media has played a role in influencing parental confidence in the MMR vaccine. Contrastingly, in a study done by Madsen, it was found that the risk of autism was similar in vaccinated and unvaccinated children. There was no temporal clustering of cases of autism at any time after immunization, and neither autistic disorder nor other autism spectrum disorders were associated with the MMR vaccine. Many controlled studies have been performed globally have found no evidence that MMR vaccine causes autism. Despite these studies, some parents remain concerned that the MMR vaccine is not safe. Now our next topic will be on refrigerator moms, a term coined to describe a parent whose cold, uncaring style so traumatized their child that he or she retreated to autism. Courtney will present the pros and Erin M. will present the cons.
The refrigerator mother theory discusses how unresponsive mothering can have an effect on our children related to issues of socialization and communication as with autism spectrum disorder. When parents are not available for their children, children then experience these issues. This theory states that this experience of coldness and loneliness can cause what we now know as ASD. Leo Kanner noted that this lack of warmth among parents with children diagnosed with ASD. He conducted a study in Sowing the Seeds of Autism field which looked at a sample of parents concerned about a child's behavior, which led to a point of obsessiveness, or what we now know as repetitive behaviors and restrictive interests with objects or rituals. His later research expanded and found that families didn't only represent the intelligent and wealthy, but that these families represented a wide range of intelligence and socioeconomic statuses, dependent on how these families interacted more than who they represent within a culture. Though foundational research for this theory, the argument has supported research on phenotype or genetics being passed down through a family tree.
The refrigerator mother or parent theory is lacking in research from the outset. The initial and many of the subsequent studies are little more than single case studies with anecdotal information. Common characteristics from multiple case studies were then plucked from each other and presented as scientifically significant. As previously stated by Courtney, this theory originated from Leo Kanner in 1943 from his work Autistic Disturbance of Affective Contact. Kanner observed homes with children with autism did not have warm-hearted parents present. His only source for developing this theory was case notes based upon his own anecdotal information. Kanner's theory gained traction as scientific scientists from countries such as Vietnam and France backed his findings. However, their scientific exploration into the validity of the causation was once again single case studies based solely on their own observations.
As I stated previously, there is a sense of withdrawal that passes from mother to child when that nurturing care isn't there. In 1959, a case study was conducted on a boy named Joey. Joey showed these withdrawal behaviors and experienced severe parent rejection while growing up. His childhood consisted of this trauma while being either ignored as he was beaten and crying, which researchers believe to be a predisposition, to have an effect on children leading to diagnosis of ASD due to the observed effects. This study also provided a sense of the impact positive parents could have on their children. Though not through use of a comparison group, parents sought psychoanalytic help during this time to better understand how they had rejected their children and learn about the effects to the experiences of those parents who were nurturing to their children.
In her book titled The Science and Fiction of Autism, Laura Schreibman illustrates that little evidence is found that socioeconomic status, race, education levels, or IQ contribute to the cause of ASD. In direct contrast to Kanner's thoughts that parental rearing would directly cause autism, one can surmise that these components will be responsible in some way for the nurturing styles of mothers. If these factors are not linked to the prevalence of ASD, they cannot be used as evidence to support the refrigerator mother theory. Even with the emergence of genetic factors contributing to the cause of ASD, there is even fewer instances of support for nurturing style to be the ultimate cause. In 2008, Smith, Greenberg, Seltzer, and Hong explored the refrigerator mother theory again after discovering doctors, scientists, and the public at large in countries in both Asia and Europe still hold fast to the theory. Their findings supported that the theory is outdated and parental affect seems to have only a slight effect on the severity of the symptoms presented, not the overall causation. This supports the scientific research regarding positive reinforcement and praise. The study highlights one major limitation with this theory, as it is nearly impossible to separate maternal warmth from other factors to truly test it. By adhering to such a theory with little scientific rigor supporting the case, ethical issues are abundant. To date, South Korea, for example, holds the lack of maternal warmth as the main cause of ASD. And as recently as 2012, the Irish Examiner retracted a story in which well-known clinical psychologist Tony Humphreys argued mothers who lack warmth and compassion are always linked to autistic children. The story was retracted due to outrage from the public and support groups, as well as lack of research supporting his statements.
During the discussion of the refrigerator mom topic, Courtney and Erin M. brought up some very valid and interesting points. The refrigerator mother theory discussed how unresponsive mothering could have an effect on children relating to issues with socialization and communication within the autism spectrum disorder. Courtney discussed the Kanner study in autism in 1959, Joey the Mechanical Boy, to support the refrigerator mom theory. Erin M. brought up the arguing points that there is a lack of evidence and research that nurturing style and maternal warmth is the cause of autism. Erin acknowledged that within her research, little evidence is found that socioeconomic status, race, education levels, or IQ of parents to the cause of ASD. She also stated that the Irish Examiner retracted a story that argued how mothers who lacked warmth and compassion are always linked to children with autism. The retraction was due to public outrage and the lack of research. Our next theory on the causes of autism is the lead and mercury and environmental toxins. Rita will discuss the pros and support the cause, while Courtney will talk about the cons with her supporting research. Ethical considerations and the research supporting their point of view will be deliberated.
Thank you, Erin. One study examined the level of mercury, lead, and zinc in the baby teeth of children diagnosed with autism spectrum disorder and compared them to typically developing children. It was found that children with autism had significantly higher levels of mercury, in fact more than 2 times more than the control group in their baby teeth. Baby teeth are a reliable measure of increasing exposure to toxic metals during fetal development and early infancy. Therefore, these results demonstrate that children with autism had a higher amount of mercury within their body when compared to controls. Additionally, the link between environmentally released mercury, special education rates, and autism rates were investigated in Texas. The study found a substantial increase in the rates of special education students as well as autism rates associated with increases in environmentally released mercury. The link between environmentally released mercury and special education rates were fully arbitrated by increased autism rates.
In evaluating research, as analysts, we rely on scientific knowledge and avoid false and deceptive statements. In order to make judgments in the best interest of our clients, we need to be free of judgment and derive our results off of science. In doing so, the findings must be reliable in order to conclude a stance on our hypothesis. Some of the discussed theories, though many occurring when ASD has yet to be understood, have resulted in a culture of misunderstanding of the disorder. When we hear a theory as a cause for autism, though these theories may not have reliable quantitative data, which has been shown through multiple research studies, our readers and listeners tend to believe, and this causes misconceptions, as well as refrain from relying on scientific data. In discussing environmental toxins, toxin levels such as mercury can be measured within hair, blood, urine, and cord blood samples. Researchers conducted an analysis of mercury levels within these various samples and found the correlation for hair, urine, and blood was not high. Researchers also discovered that these low levels could not cause autism, as there was also a lack of low-risk level association. The only possible controversial issue, though coinciding with low-level mercury exposure, was of having extremely high consumption of fish regularly. In 2010, Schultz conducted a study testing similar samples for levels of mercury. It was found that hair samples provide both increased and decreased levels of mercury within samples of children diagnosed with autism. Levels of mercury in blood also showed no differences, resulting in an unrelated relationship. These levels vary among individuals who are and who are not diagnosed with autism. An individual diagnosed may have lower levels of mercury than an individual who is not, and vice versa. There is no definitive link between high levels of mercury and only individuals diagnosed with autism.
Studies of monozygotic twins report an average 60% concordance rate, indicating a role for both genetic and environmental factors in disease expression. A review of medical literature has shown that exposure to mercury can give rise to the symptoms and traits defining and/or commonly found in ASD. Mercury can cause impairments in social interaction, communication difficulties, and repetitive and stereotyped patterns of behavior, which fulfills the DSM autism diagnostic criteria. Mercury can also cause prominent characteristics in ASD, including sensory abnormalities, emotional and psychological changes, movement disorder, impairments in abstract or complex thinking, severe sleep disturbances, and self-injurious behavior. Physiological abnormalities that are more common in ASD populations and are known to be caused by mercury exposure include GI problems, autonomic nervous system disturbance, unusual EEG activity, immune system alterations, irregularities in neurotransmitter systems, and nonspecific brain lesions.
Another argument lies in comparison studies. Wright and colleagues conducted a comparison study of urinary mercury between children with ASD and a control group. Participants for methodology included 56 children with ASD compared to their 42 siblings, and a control sample without ASD in a mainstream school sample of 121 students, and a control sample of children without ASD in special schools, which was a sample size of 34. Using an analysis from children comparing concentrations of mercury within urine, there were no statistically significant differences concluded. Williams and colleagues also conducted a study comparing mercury levels in children with ASD and their typically developing siblings without diagnosis. Research compared levels of mercury within their hair. No significant differences were observed through a t-test conducted. Physical findings discussed supported issues of, for example, hypertension, rash, and visual constriction if experiencing high levels of mercury. These findings are not seen in children with autism. These results also argue that siblings are likely to have similar exposures as they grow up together, but this study found no significant differences and that there was not just one correlation between these sibling comparisons. One sibling may have high levels as another has low, but in comparing another group of siblings, this may not be the case. There were various outcomes.
As Courtney and Rita have presented, the viewpoints for arguments in support of and against environmental toxins and the possible role they play in the causation of ASD. Twin studies have shown some promise in support of their role. However, studies with larger subject pools yield inconclusive or no results in support of environmental toxins. Many of the studies available in this area reported by both sides show an increased level or decreased level of toxins in the participant system, which only yields loose comparisons and correlative effects. More research is needed in this area to determine the role, if any, environmental toxins play in the causation of autism. While the topic of this overall debate has been focused on the causes of autism, there are a number of ethical guidelines that behavior analysts needs to weigh when considering working with individuals. A few guidelines that tend to overlap in relation to one another are reliance of scientific knowledge, competence, integrity, and accepting clients. Behavior analysts must be honest with clients regarding what services we provide and the areas of expertise and training we have to work with certain clients. There would be great issues with these guidelines if families or clients adhere strongly to these causations and the treatments prescribed by the supporters of these theories of treatment will be beyond the scope and training of a behavior analyst. It also brings into account treatment efficacy, in which behavior analysts need to provide scientifically valid services that benefit the client. If a behavior analyst is presenting these causations as scientifically valid for treatment, guideline 8.01, ethical violations by behavioral and non-behavioral colleagues, may be present. At the very least, guideline 9.0 states a behavior analyst has ethical responsibilities to society to promote those ethical principles of behavior treatment. I'm now going to turn over to Allison to summarize the entire debate.
So, the topic of what is the cause of autism is one that's been controversial for many years and will continue to be so as years go on. The reason for this is because it's been proven that there is no definite cause with no definite cure as well. Because of this, many families of those with autism, as well as those who work in the field of autism, turn to the media and internet when looking for answers about why an individual has been diagnosed with such a mysterious syndrome. The MMR vaccine is a cause that many have turned to when trying to find the reason as to why someone has been diagnosed with this disorder. Social media has played an influencing role on this, as it has changed many parental attitudes about the finalizing decision of actually having their child vaccinated. Parents felt that by following the anti-vaccination movement, their children would be less likely to fall under the diagnosis that is still unknown till this day. While many have turned to the MMR vaccine as a probable cause of autism, it was once thought that the cause was because of the way parents treated and loved their child. While the way a child is raised can have some effect on how a child turns out, it cannot simply give a child a diagnosis of such an unknown disorder such as autism. Many children that were found to have autism actually came from families of mothers and fathers who were very nurturing and loving. Research has truly failed to support that parents are to blame for the prevalence of autism spectrum disorder because it is simply outdated. Finally, many have felt that the cause of autism is a result of environmental toxins. It has been stated that environmentally released toxins such as mercury, lead, and zinc were increasingly higher in individuals that are labeled as on the spectrum. Though, when tests have been conducted to test the urine and hair of those with autism in comparison to those who are not on the spectrum, there have been no significant differences to be found. All in all, there really is no exact cause of the growing prevalence of autism. People turn to the internet and research when they feel as though they need answers or solutions, though with autism, there is no definite answer yet. Autism is a mystery, and as the prevalence of it continues, so will the search to find the cause that everyone has been looking for so many years.
Okay, well, great job with your debate and presenting some of the different theories in regards to the causes of autism. I think this is a really relevant issue because there aren't really very clear answers about what are the causes of autism, and so exactly as your group talked about, there's a lot of confusion about what's going on. And so the first question that I had is, how might you respond to a parent who asks about the causes of autism? What might you say?
I guess, who wants to go first?
Go ahead, Alvin.
I would just kind of give them more of a reasoning or like kind of a background of what they have studied throughout the years, but really just kind of say that there really is they don't really have an idea yet of what exactly the cause is, but they're continuing to do research and try to figure that out. But for now, they're really not sure.
I would probably also, in piggybacking off of that, provide them more with the strategies and interventions that can help their child to be successful in whatever environment, in school, in the community, as to focus more on what they can do to help rather than the cause.
Yeah.
Right.
So focus more on how to cope with it versus worrying more about how they got it, kind of focus on how can you move forward from this? What can you do to help with the situation?
Going off of that, I would also gear them towards any kind of support group, especially if their child is newly diagnosed and they don't have anybody to turn to. I'm sure if they had found a parent support group, that might help them guide them in the right direction.
I think I would always bring it back to what services as a behavior analyst we can offer, making sure that the information that we offer is within the realm of behavior and ABA, and that these are within our scientific studies, and here's the support for those. And while they're welcome to do that research on their own for the causation, this is the type of service that we can offer.
I would discuss the research a little bit, but avoid jargon. But I would explain like how the MMR vaccine, like that theory, is not supported by research, despite what has been found on the internet, and different things like that. And I would probably also guide them to different websites to find their own information, so that they can do a little bit of research for themselves.
Okay, excellent. Well, I think you certainly brought up some certain points, definitely emphasizing the fact that as a behavior analyst, you are beholden to behavioral theory and behavioral principles, and so you don't want to practice outside your boundaries of competence or outside of or in regards to theories that aren't based in behavioral principles. So I think that is, definitely an important point. And so the next question I had, and you kind of touched on this a little bit, but I was just curious if you have anything else that you could add. And what do you think would be a BCBA's ethical responsibility in regards to when they're talking about the causes of autism?
That kind of with what I was saying, like I think it's our responsibility to discuss like the research. Like if a parent were, I don't know if I want to get the vaccine. I believe that's within, we study this, we know the research. I believe that we can tell them, like the research does not support this. I think they should know the facts and not what they just Google or what their friend tells them, another parent. But I think it's important too also to discuss like just like what you know. We know causes of autism because we've like studied it. But if it were like another area of autism that I hadn't, I didn't know anything about, I would be honest, maybe ask a supervisor or something like that. So.
I guess, yeah, just being like truthful and honest, I think is the best route to take, because ultimately you can give them you can help them and guide them in a situation and give them these ideas, but ultimately it's their life and their choice and their child, so they're going to make the decisions they want, but it's our job to help guide them on the right path and be supportive of what they feel is always the best for their family. Yeah.
Any other thoughts?
I think I would, like I said before, I think I would just always bring it back to what's been found within our body of research within the behavior world. Certainly if you're talking among people outside of a family and you're having sort of a discussion like amongst colleagues like we are now, you can always weigh the pros and the cons within that setting. I think whenever families are looking for discussing causes or discussing things of that nature, I would always be hesitant to engage in that conversation, because even without scientific evidence to back up some of the theories, families really do adhere to them. And within our own code of ethics, we should not be judging or doing anything. So as long as they're accepting the treatment that we're offering and working with them, I think that's the safest place for us to be ethically.
Okay, well, definitely, I think your group touched on some important points in regards to, thinking about how you're going to work effectively with people to be able to get buy-in from them and kind of, understand where they're coming from. And a lot of times, parents really are seeking answers in regards to, okay, my child has this, but, why did they get it, and so, they're pretty desperate for trying to find an answer for what happened in regards to why their child was diagnosed. So I think, like your group talked about in the debate, focusing on moving forward and, what can be done to help their child be as successful as possible. what is the best course of action in regards to working with them and making sure that you are able to effectively collaborate them and also be practicing within the scopes and being adhering to the ethical codes and what's stated in there. And so it's always helpful too to just provide some education to people about our ethical codes and what it means for us to be a BCBA and what are our limitations in regards to that, and specifically what can we do to help them. Yes, we can help provide interventions, but in regards to finding a diagnosis that's kind of outside of our scope. So just be making sure that you can articulate that and communicate that when you're working with people, I think is important too. So the final question I have is just if anybody has any personal experience that you would like to share related to this topic at all.
I do actually. I was teaching K through second autistic support down in Georgia, and I had a parent who swore that her daughter was born typical. There was no problem. She was verbal. She was happy. No problems whatsoever. And as she told me that she got the MMR vaccine, and then about a week or two later got a really high fever, and ever since that point, her daughter was nonverbal, would not make eye contact, had the typical autism, just like everything that goes along with autism. And at that point, I was only in my third or fourth year as an autistic support teacher, and I had no research, so I really couldn't argue the fact, and I couldn't give her any facts either. So I just had to be there to support her and provide her daughter with my services.
Well, thanks for sharing that, Erin. I think you bring up a really important point and kind of, why so many people are, it's easy to convince people about the correlation between the timing of the vaccinations and when autism is first diagnosed, just given the age. And then, because we know sometimes for some people who are diagnosed with autism, they are kind of progressing typically, and then they start to lose skills that they've gained. And so sometimes that does correlate with the age that they get the vaccination. Mm-hmm. And so that only reinforces the idea that, oh, it is the vaccination that's causing it. So thanks for bringing that up as an example. Does anybody else have anything else you'd like to share?
I would not necessarily a cause for autism, but I think it goes on the other end as well, where we might experience in the field the theories along with curing autism. So that's just another thing to keep in mind. I'm sure we all had experience with that, and if not, will as our career goes on. But with not only causes, but in curing autism, the different theories that stem from that as well.
Yeah, I think that's a really important point too, is I mean, I don't know if there's necessarily enough research to say whether autism can be cured or not. I mean, we certainly know that there's interventions that can help people be more successful and have more access to do the things that they want to do in regards to autism, in regards to actually finding a cure that totally ends autism. That I think that is still up for debate, especially in regards to the research and evidence to support that or not. I think a lot of times there's progress made, or perhaps it could have been more just a developmental delay initially, and it wasn't real, like ASD as as defined in regards to what the diagnosis is, and so that might be part of the reason for confusion for people who think that their child was cured as well. So again, I think there's just a lot of limitations in regards to the research for some of these topics. So I think it's that's not the answer that people want to hear. They want to know what caused it. So kind of being able to explain that, I think, is important. Any other final thoughts or comments? Okay, well, we could go ahead and end the recording then.